You're right, I can't fix Ehlers-Danlos, but my goal as a clinician is to make you forget that you ever had it. EDS is one of those conditions that you carry your whole life because it's genetic. And a lot of people who have EDS don't know it or suspect it because of hypermobility, but their doctor will only give them a diagnosis of fibromyalgia because genetic testing is expensive and insurance doesn't cover it all the time. When we work with EDS patients in the clinic, we take the very same approach that we take to every other patient who gets labeled with fibromyalgia or just has chronic pain of an unknown cause, which is we put them through the appropriate stages of treatment from our fibromyalgia protocol. Because by the time they make it in, most EDS patients are struggling with inflammatory damage from chronic infectious viruses like Epstein-Barr virus. They're struggling with dysbiosis. The guts are made out of connective tissue and they're more prone to that than other people. They're struggling with autonomic dysfunction. They're struggling with chronic injuries that haven't healed properly. Those are all things that we address in our stages of treatment. Chinese medicine considers those things excesses. And once they're out of the way, then we have to tonify deficiency. And Ehlers-Danlos is a genetic qi deficiency. Here, I'll show you what I mean. One of the forms of qi that Chinese medicine has been able to identify biomedically is called nitric oxide. Ehlers-Danlos patients make less of it. They have a genetic qi deficiency, which is why they're more prone towards all of the inflammatory damage that then gets labeled as fibromyalgia. So the capstone piece of treating any EDS patient that I feel any responsible clinician should make is a referral to a skilled physical therapist or athletic trainer who knows how to help them build a progressive, gentle resistance training program that's personalized for them. Because the data show that EDS patients, when doing resistance training appropriately, build strength and resilience. It's about cultivating anti-fragility. And classically in Chinese medicine, weightlifting, resistance training, is a method of using Qigong to boost Qi. I also have a little bit of lived experience in this respect. I haven't had an EDS diagnosis, but I suspect it runs in my family.